Good evening. I'm Lloyd Smucker, Congressman from Pennsylvania's 11th District, which covers southern part of York County as well as Lancaster County. I'd like to thank you for joining me on this telephone town hall. We hold these on roughly a monthly basis. It's always a great way for me to both talk about some of the things that we're doing here in Washington, D.C., but also hear from you. Questions, concerns. It's always a great discussion. I really look forward to these, and then receive a lot of good feedback throughout the district from people who have participated in this. So I imagine some of you have been part of these before. Tonight's going to be a special town hall. You're all, I'm sure, fully aware, hearing about the coronavirus, the pandemic, also known as COVID-19. And we've been receiving regular updates here at the federal level from many different departments of the federal government, and I want to share some of that with you, share some of what we've been doing here to address this, share some of the information that we have. And then tonight, I'm pleased to have some special guests with me, who I'll introduce in just a little bit, who will be talking about what's being done at the local level and in our local health care systems as well, hospital systems. And so we'll be getting to that. I will apologize. Some of you who've been on this before know I repeat myself a little in the beginning because people are continuing to join us as I'm talking. So again, for those of you who have just joined, I appreciate you being part of this. I'm Lloyd Smucker, the Congressman from Pennsylvania's 11th District, covers southern York County and Lancaster County. I'd like to thank you for being part of this. We do this on about a monthly basis. We're doing a little differently tonight. We're literally calling every home in the district, and so we've split it into two 30-minute segments. So normally this is an hour. It's 30 minutes tonight because we wanted to specifically address the coronavirus and bring some experts to you with, I think, some important information about what is happening. And so tonight it'll be 30 minutes. There'll be three of us talking, and we'll maybe have time for questions, but we may not get to questions tonight. I'm not sure. So again, Congressman Lloyd Smucker, I'd like to welcome you to this telephone town hall. The special guests I have with me tonight, I want to introduce, and then in a little while, each of them will be providing an update and sharing their thoughts with you, is York County Board of Commissioners Chairwoman, Julie Wheeler, as well as Dr. Gasparak from WellSpan Medical Group. Really, really pleased, Doctor and Commissioner, that each of you have joined me here this evening. I think you have important things to share with the listeners on the phone, with our constituents here. So again, tonight we'll be talking entirely about the coronavirus pandemic. We all have been paying attention to this. We are concerned about the impact on our communities, about the impact on our families, ourselves. And so I thought it was appropriate for us to share what we know at this point. Here at the federal level, we are receiving updates on our briefings. We had, I think, 3 briefings just today. And every day, additional information is being learned about the virus and what it means. This is what's considered a coronavirus. It has been named an epidemic, or a pandemic, which means it has widespread impact on multiple countries and across the world, and without a specific treatment yet at this point, which makes it particularly consequential and potentially dangerous as well. One thing I want to say is that this has potential for a significant impact on our communities, but we still can do a lot. Each one of us can take actions that are recommended to help mitigate the spread, and that is very, very important. Just this morning, experts were talking about the difference in the spread in South Korea versus Italy. South Korea quickly shut down things, were really focused on ensuring that there's not a lot of contact with someone who has the virus, and that didn't happen as quickly in Italy, and we can see the difference in the number of cases and how that's spiraling up in Italy. We still have a chance in the United States to help to slow the spread of the virus. And so there are recommendations from CDC. They're simple recommendations. They feel like they're common sense, but they're very, very important. If there's anything that we can leave with you this evening is to take that seriously. You can go to the CDC website. It's cdc.gov, and it's things as simple as washing your hands regularly with soap and water for at least 20 seconds. Use sanitizer if soap and water isn't available. Cover your coughs or sneezes, not with your hands, maybe with a tissue or your elbow. Clean, disinfect surfaces that you're touching on a regular basis. If you're sick, stay home. Don't spread a sickness to other people. Avoid large crowds is a new recommendation, and that's important as well. So these are all recommendations that are very, very important and will change the trajectory and save lives. What we know about the disease is that it is highly contagious, more contagious than the typical flu, and it has a higher rate of impact of fatality, really, but differently for different populations. So for some reason, this particular virus doesn't impact young people as some have in the past. There's been no death that we're aware of in China as of this morning, at least, of any child 10 years old and under. Where there's significant impact is on the elderly, and particularly if someone has a pre-existing condition, asthma or lung problems or heart issues or anything of that sort. That's when this can become particularly dangerous and you need to take special care not to come in contact with someone who has the disease. We have already taken some actions in Congress to combat this. First of all, CDC, the whole of the federal government is focused on ensuring that we're doing everything we can to prevent or slow the spread. This is consuming everyone's time, and they're reporting on that and learning more about it every single day. The Centers for Disease Control, the Institute of Allergy and Infectious Diseases, Health and Human Services, the Pennsylvania Department of Health, the Vice President is leading the task force, and on and on. But we in Pennsylvania so far have 22 cases. There are 0 in York County that have been confirmed, which is very, very good news. The 22 cases in Pennsylvania so far confirmed. There are an additional 81 pending at this point. That number is updated every day. In terms of actions that we've taken, in the legislature, we've already passed an emergency funding bill that will provide $8.3 billion that will assist states and local communities in taking actions to prepare. It develops more testing capabilities, provides funding to develop treatment, which will be coming, and then also provides funding for vaccine research, and that will be coming as well, but it will be a year or two before we have vaccines in place for this. With that, why don't we go to Commissioner Wheeler. Commissioner, thank you for joining us. Would you please give an update of what's happening at the county level?
Sure. Thanks, Congressman Smucker. At the national and worldwide response to COVID-19, the coronavirus changes daily. We want our York County to know that the county commissioners are actively engaged and working intensively together in monitoring this ever-changing situation. We're receiving multiple daily updates from the State Department, the federal government, our legislative representatives, our partners at both WellSpan and UPMC, Dr. Howie, who's with our York City Bureau of Health, along with our emergency management agency. We've been working on contingency and continuity of government plans as we understand that government functions need to continue for critical departments for our community. We expect guidelines will continue to evolve, and the county is committed to a constant evaluation of county needs and resources, collaborating with our partners at WellSpan, UPMC, the York City Bureau of Health, as well as the county's Office of Emergency Management. We want to continue our education around the preventative measures which Congressman Smucker shared. Those have remained constant. Coughing or sneezing into a tissue or a flexed elbow, then throwing the tissue in the trash. Avoid excessive touching of your eyes, nose, and mouth with unwashed hands. Avoid close contact with individuals that are sick, sneezing, or coughing, and stay home when you are ill. Clean and disinfect surfaces and objects that are frequently touched. If I sound a little repetitive about this information, it is on purpose. This information about preventative measures is so important and cannot be overstated. The health and welfare of our York County community is a top priority. And as the Congressman mentioned, as of today, there are no confirmed cases of COVID-19 in York County. We also know that community spread has not yet been confirmed in Pennsylvania, and contact of a contact presents a very low risk of spread. Even in this low-risk environment, the county is continuing to take and put in place proactive and preventative measures. County operations are continuing. We've communicated with all county departments regarding their needs for remote working capabilities to ensure that access is available should it become necessary. And for those county operations like 911, the Youth Development Center, and the prison that must be open 24/7, we have plans and measures in place to keep those facilities open, up, and running. And in the abundance of caution, we would advise avoid attending large meetings, conferences, trainings, or community events with people of more than 250. And this just echoes the governor's remarks from earlier today. We realize this matter is fluid, and we've gathered the experts we need to make the important decisions and changes to protocol as the situation demands. And I just want to reiterate, the health and welfare of our York County community is a top priority. Thank you.
Thank you, Commissioner. We really appreciate your leadership. I know that you and your entire team has been spending a lot of time on this as well. We have a lot of confidence in your leadership as we work through this. As I said earlier, I know together that we will get through this. We don't know exactly what it's going to look like, but we've been faced with the crises before, and we're just so thankful for to have you there to lead the way in York County. So thank you.
You're welcome.
Dr. Gasparak, would you tell us a little bit about what you know about the disease, the virus, as well as the response of the medical community at WellSpan and in York County?
Sure. First of all, thank you, Congressman Smucker, for allowing me to talk tonight, and thank you for your prompt response to this very important matter. I'll start with what WellSpan is doing to prepare for this. We've been meeting here at Incident Command every day since we first got word of this, or a little over a week, to ensure that we have adequate staffing, adequate supplies, and we have plans in place to handle the patients who need our services. We train year-round for these types of situations, and as you probably recall, we've gone through a couple situations in the past few years that have called us into Incident Command, so we're well-versed on how to run this center. What we've done is we've set up temporary outdoor patient screening and testing areas for patients at our hospitals. So testing will not occur inside unless it's in a negative airflow room. So it will not be done in our offices or in our labs. It will be done outside in open air settings, sometimes under a tent, sometimes under an awning. And what that does is it limits the potential spread of the disease, and it helps us preserve the negative airflow rooms that we do have in our hospitals. So you're going to be seeing those outside tents set up at our hospitals, and then we're also going to have similar testing sites set up, one in each county within WellSpan. We do have a front-facing website page at wellspan.org. There's a red banner at the top with a link to all the updated coronavirus information for patients. We have a running tabulations of frequently asked questions. There's information for medical professionals. And then there's links to the state and federal sites. Here at WellSpan, we are following all of the CDC recommendations very closely. So there's links to the CDC site on there as well. As far as the virus goes, some of this is going to be a little bit repetitive, but I think it's a very important message that we need to hammer home. So forgive me if some of it's repetitive. When we talk about coronavirus, patients are really split into two categories. One is the worried well, and the other ones are those at risk. So the worried well are healthy people under the age of 60 with no underlying health conditions. The majority of these folks, if they come in contact with the coronavirus, would be considered at low risk for developing complications. And the other group is anyone over 60 or who has an underlying health condition. Those people, that group, would be considered more at risk for developing complications from the coronavirus. But it's very important to recognize that it is everyone's job, regardless if you're in the low risk or the high risk group. It's all of our job to work together to keep the transmission rate of this virus as low as possible. That's really the best opportunity we have to protect ourselves right now. So I'm going to review some of the things that we can do to help keep that transmission rate low. The first, as was mentioned, is washing your hands frequently with warm soap and water for at least 20 seconds. Avoid touching your face, which is hard to do. If you're conscious about it, you'll realize how often you touch your face during the day. Cover your mouth with a tissue and then throw that tissue away. Avoid being around sick people. So unless it's absolutely necessary, we would encourage people to not go into nursing homes to visit, not go into the hospitals to visit. Try using alternative means of communication. You could try use an iPad to Skype with a family member. Try doing that. Only when it's absolutely necessary to go into these settings. As was stated before, if you're sick, please stay home. Don't go to work. Don't go to your place of worship. Don't go to the gym. All you're going to be doing is exposing other people. I think all around you would be completely understanding if you stay home because you have symptoms. The other important thing to notice is if you have symptoms, and the main symptoms are fever, cough, shortness of breath. If you have those symptoms and you suspect it could be related to a coronavirus, please call your physician first. Our instinct tells us that we should be going to an urgent care or going to our doctor's office for a walk-in appointment, but what we want you to do is make the phone call first. We really need to be triaging your care over the phone first so that we can identify what is the most appropriate setting for your care and determine whether or not testing is warranted in your case. So please, don't show up places. Please call ahead. And then the last piece is kind of obvious: eating a healthy diet, getting adequate rest and exercise. These are things we should be doing anyway, but it's vitally important when we're trying to keep a strong immune system. As far as your daily habits at work, the main one is avoid shaking hands, which again is tough. You'll see people bumping elbows sometimes or waving instead of handshaking. Very important. At your workstation at work, you should be using disinfectant wipes on your keyboard and any other items on your desk. If you go to the gym, make sure you're wiping down your equipment. If you're going shopping, make sure you're wiping down the handle on the cart with disinfectant wipes. That's if you need to go out. But you might have heard the term social distancing at this point, and that's really key, is that we want people to stay home and isolate as much as possible in order to help contain the spread of this virus. The last point I want to make is just about stockpiling. So please resist the urge to hoard or stockpile items such as water or toilet paper, which I've heard a lot about in the news. It's really unnecessary at this point. As I stated before, we're closely following the CDC recommendations, and they recommend keeping 3 days of food and water on hand for emergencies, and then it's always a good idea to have about 30 days of your chronic medicines at home just in case you need them. Also, along those lines, avoid using the use of surgical masks. So as I mentioned in the beginning, one thing that we're tracking daily is our supplies, and personal protective equipment like masks are vitally important for our healthcare providers when they're taking care of sick patients, or for people who are infected with coronavirus. Then masks are helpful, but they're not particularly helpful to help prevent you from getting the virus. So please resist the urge to go out and get a bunch of masks. As Congressman mentioned, as of today, we have 22 presumed cases and none confirmed in York County, which is great. The takeaway at this point is to please take these precautions, but stay calm. We're going to work together to get through this, keeping in mind that Health systems like WellSpan, our local government officials, schools, and local organizations across the county are preparing daily and working hard to keep us all safe. And with that, I'll turn it back to you, Congressman.
Thank you, Doctor. We do have a few more minutes, so we'll have time to take a question or two from the listeners. If you have a question or a comment, just press 0 on your telephone right now. And we have individuals who answer the phone, and we'll take your question. So again, if you have a question or comment, we have about 5 minutes left. Just press 0 on your phone. Doctor, I do have your method of testing sounds great, the outdoor screening. We have heard here of the shortage in tests, which everyone's working hard to ramp up the manufacturing of the tests and make them available. Do you have tests available today?
We do. So to date, up to this point, we had to rely on the Department of Health to do all of our testing, and they were capped out at 150 tests across the state per day. So it really was risk stratifying which patients needed those tests and which ones didn't. As of tomorrow morning, we have commercial tests available, and we will start doing our own testing. So as we're testing more people, I think we're going to start to see an increase in the number of cases pretty quickly.
I hope this was helpful. Again, cdc.org. You can also go to my website to get a link to that, smucker.house.gov. The county has information available on their website as well, and I'm sure WellSpan has a lot of information available as well. So again, you can be assured that everyone on this call and everyone at all levels of government in our healthcare system are doing everything that we can to ensure that not only is the information available, such as that you heard tonight, but also ensuring that we doing everything we can to get through this. I'm confident that we will get through this together, and we'll come out in a few months, and hopefully things will be improved a lot by then. So thank you for joining us on the call. Doctor and Commissioner, really appreciate you taking the time to be part of this as well.
You're welcome.
Thank you.
Yep. Thank you all. Have a great night. Bye now.